Dr. High.
Hi, I feel bad that I don't have my glasses with me.
Oh, no, you need them.
Where, yeah.
How are you?
I'm wonderful. Thanks for having me. This is great. It's been fun listening to all of you.
Could you tell us a little bit about yourself and a little bit about what you do? And then everybody will understand why you're here. So.
All right. Well, I'm an internist and an obesity physician. I've been practicing obesity medicine since 2012, and I trained at the University of Toronto, and I'm based just out of Toronto. And my interest is really helping women with obesity who've been harmed by like toxic diet culture and who have developed disordered eating behaviors. And I use cognitive behavioral approaches to address disordered eating, like mindless snacking, binge eating, compulsive overeating, even emotional eating. And we equip women with these tools and really empower them to create their healthiest habits. And so my whole approach is really managing weight from a place of like kindness and honoring your body and loving your body, as opposed to like the shame-based approaches that we've seen in the past and kind of hating on your body. So that is what I do. My program is called Best Weight, and it is available across the world. It's a combined coaching and medical program. So for all of our Canadian clients, we have physicians, obesity physicians in every province who do the medical side of things in terms of medical supervision for the GLP-1s or any other anti-obesity medication that we might be using in our toolbox. And we really look at that comprehensive approach to creating your healthiest lifestyle, addressing the emotional and the cognitive side of things, as well as the physiological side of things.
In terms of like these sort of unhealthy cycles, like how does diet mentality, like the whole idea behind like the diet culture, how does it keep us from having like these healthy habits? How does it make these unhealthy cycles like happen and continue?
Yeah, I think it's rooted in like diet mentality was rooted in needing to create a certain aesthetic, right? Like it really was never about health. It was about creating the way, primarily women, but how a woman's body should look. And the answer to creating that aesthetic was that you just need to eat less, right? Eat less, exercise more, which everyone has heard. And that's all about restriction, right? And restriction feels terrible when you try to do that over a long period of time. It feels like deprivation. It's about food rules. You follow these rules and you'll lose weight. And anytime we have rules imposed upon us, we have this part of our brain that's really wants to rebel against that. It's like, I call it the toddler. And the toddler's like, don't tell me what to do. Like, I'm following my own rules. And so we have this sense of like, screw it. I'm not going to follow these diet rules. And so the diet can only last for so long, right? Because it doesn't feel like it's your values and like what you want to be doing. It feels like something that's imposed on you, and human beings just don't really like that. So
that's a super good point. Yeah.
It just does. It has to feel good for you to continue doing it. Otherwise you're just not going to continue doing that for the rest of your life. And there's so many problems with it, right? Like even the idea of like diets create good and bad foods, or maybe we label that in a nice package and we call it like red light and green light foods to make it sound better. But really it's the same thing at the end of the day. It's like villainizing foods. And then if you eat those foods, you're now a bad person. And so then guilt and shame enters in, and all of these emotions just lead to very short-term interventions because no one continues to make positive changes from a place of shame or guilt or feeling terrible about themselves.
Yeah.
Well, building on that, you mentioned cognitive behavioral coaching with your practice. Could you touch on the definition of cognitive behavioral coaching and what differentiates it from other approaches to therapy and coaching in the realm of, I want to say diet, but not obesity treatment. There we go.
Yeah. Absolutely. Coaching is a really broad term, and it can range from everything from those people on the internet who write out like a meal and exercise plan and prescribe it to you, or having someone text you every day for accountability. So it is a really broad term. The way I frame it with cognitive behavioral coaching is we're really using tools from different psychotherapeutic modalities like cognitive behavioral therapy or CBT, dialectical behavioral therapy, which is DBT, and acceptance commitment therapy, which is ACT. We're just kind of taking tools and skills that we've picked up from these different modalities to really kind of show people how when we work on mindset and when we work on reframing unhelpful or self-defeating cognitions, that really is what can lead to sustained behavior change and getting the results that you're wanting in your life. So it's really looking at the effect of our thoughts and our feelings or emotions and how that can impact the choices that we make, the actions that we take. Yeah.
Wow. Can we address the common misconception that GLP-1 medications are silver bullets? So many, especially new members of the GLP-1 community, are just like, well, I'm taking these medications and that's supposed to be it. So can GLP-1 medications be used by themselves for obesity treatment?
So the answer, it's never a simple answer. For sure, they are being prescribed by themselves all over the place, right? You can go to your family doctor and you can get a GLP-1 medication. And I think that there is benefit to that. Like, I don't think that we need to withhold medication and say, like, you have to work on behaviors to get this medication. We don't do that with any other medical condition, right? But I think, and from experience with a lot of people, there will be limitations, right? So you can absolutely take medication, do nothing else, and you will end up eating less, and you will end up changing some of those behaviors because the medication is going to help you to do that. But the more you combine it with tools to overcome stress eating or just like habit snacking because it's 9 o'clock at night and that's what you do, right? The more you become aware of that, or the more you hear your body, and so you're like, hey, you know what? Let me build muscle. Let me build strength because that feels good. It gives me confidence. The more you combine those things, the more you're going to see improvements in your health and those overall changes and results. And I think, when we talk about emotional eating and the cognitive behavioral tools, where that comes in is, let me give you an example. You can be taking a GLP-1 medication, but if you're not like Corey, who lost a significant amount of weight very quickly, that's not everyone's story, right? So let's say it's someone else who's taking these medications, but maybe it's coming off a little bit slower, and your whole self-talk the whole time is like, nothing's working. Like, this is going so slow. What's wrong with my body? Like, my body's broken and I can never lose weight. That self-talk, right? That internal narrative makes you feel demotivated, defeated, whatever kind of D word you want to use. And the consequence of that is you start engaging in self-defeating behaviors. So you start making poor choices. You start kind of screw it eating. And that's where we have to look at, how are my cognitions, which is a fancy word for thoughts, how are my thoughts, my inner self-talk impacting the choices that I'm making, how I'm showing up for myself every day? Because if we can empower those thoughts, we're going to take better actions and make better choices.
Yeah.
Great.
What are some tips that you can share with us right now for our listeners, just to kind of those who are struggling with nighttime snacking?
Yeah, for sure. Maybe I'll give the framework that I outline in the course. And really, I describe overeating, because any type of nighttime snacking, mindless eating, binging, compulsive, it's all overeating, right? Anytime we are using food when we're not actually needing it for nourishing our bodies, we're overeating. And I think that definition is important because a lot of people think overeating and they think that means binging, right? But it's like, no. It's like going to your friend's house and having, coffee cake as you're drinking tea is overeating if you're not actually hungry at that time and needing that food for fuel. And so we all do it. We all overeat. It's when the overeating becomes problematic that we want to address it. So when we look at nighttime snacking, I kind of break down overeating into 3 things. It's either you're over hungry because you were restricting during the day, trying to make up for yesterday's overeating, you're skipping meals, you're just not prioritizing eating. And so now you're getting to nighttime, you're winding down and you're over hungry. And so you just consume, all the things, you're eating too much. Or it's over desire, which is the food stories that we have, right? Like Janine, you were saying, like Popeyes just like tastes, it smells so good. Like, we have these food stories of like, oh, but like, I'll just have one, and it's so delicious, and I only get this one time.
So magical, yeah.
Right? So we have over desire, which is like urges and cravings, and then we have emotional eating. And if we tackle those 3 things, then we can stop using food when we don't need to be using food. So kind of the simple things over hunger is really, how are you nourishing your body during the day? How are you feeling yourself? Are you giving yourself enough protein? Are you getting the fiber, the veggies in? Are you kind of balancing out with the complex carb? So really focusing on that balanced nourishment during the daytime. And I like to just describe it as like your daytime version of you is helping out your nighttime version of you. Right. So like daytime you can do nighttime you a big favor by planning a little bit for, to make sure you're fueling well. And then the second part, which is over desire, is really looking at how are we talking to ourselves about food? What are the kind of like sexy food stories that we're creating? And do we want to start maybe reframing those stories, challenging them, learning how to address urges, which is, just those cravings that come up in our mouth. As you were saying earlier, we kind of frame it as like heart hunger, mouth hunger. So mouth hunger is when you just want something crunchy or you want something sweet and you can feel it in your mouth. That's not physical hunger. That would be mouth hunger or psychological hunger. And so we can kind of learn that, hey, we can allow urges to be present without actually reacting to them by going and eating the food. So it's normal. We have urges all the time. Like if you get angry, you might have an urge to punch someone. Doesn't mean you go do it because you have a frontal cortex that inhibits that behavior. We can actually apply some of those same principles with food. It's just that food is a very powerful reinforcer of behavior. So when you've done it once, that feedback, that reward that you get from eating the food at 9 o'clock at night, when you're winding down, watching Netflix after a stressful day and your kids have been a disaster and they've finally gone to bed, and you eat the ice cream or the chips or whatever it is, and you get that reward, that dopamine to your brain, that's a very powerful reinforcer. So now the next night, your brain's going to remind you to do that again. And that's how habits kick in. So that's kind of what's going on in the background of why we can so easily get into these habits of overeating foods or using foods, to fix boredom or stress or frustration or just out of habit, because our brains learn really quickly. And so we can tackle that with the over desire piece. And then the last one is the emotional. And really what I teach is that, we need to learn how to feel our emotions. And because none of us learns about emotions in school at any point, we become these adults who have all these emotions. And all we've heard is like, don't cry or, cheer up, be happy. And so we think that when we experience a quote unquote negative emotion, which is an unpleasant sensation, that's a bad thing. And so a lot of us use food to escape feeling these things without realizing they're totally normal, totally part of the human experience. And so we actually just need to learn some skills for how to allow those emotions to be present without needing to use food to distract from them.
Wow. Yeah. Talking to obesity specialists and, advocates, and we gain, knowledge from you all, we know that hormonal imbalances are a contributor to weight gain, especially those of us who are in perimenopause, menopause, so resulting, sometimes in obesity. How can we balance emotional, hormonal, and behaviors? So like, in other words, how would one start their own approach to it all? Because it can seem really overwhelming.
Yeah, and I think that's where obesity medicine is actually quite complex, and why we have obesity specialists looking into all of this, because you really do kind of have to address all the pieces, and it's going to be different for everyone too, right? So my area of interest is disordered eating, emotional eating behaviors. Not everyone with obesity is an emotional eater, right? And lots of people are emotional eaters and they don't have obesity also.
Totally. Yeah.
And so everyone is going to be different, and really does require that individualized approach. And so, meeting with an obesity specialist who can kind of address, your weight history is a really good place to start, because, for example, we can tell so much from, if you're someone who has had obesity since you were 4 years old, right? Like there is just a strong genetic component there for sure, right? As opposed to that person who maybe was lean their whole life, and then they had a car accident, they became depressed, they were put on antidepressants, and now, they've got chronic pain, and they've gained weight and developed obesity. So there's just so many different causes, and it really takes someone who can look at all of that, look at the whole picture, and treat that individual. And that will require sometimes the medical treatment, whether that's an anti-obesity medication like a GLP-1 or even bariatric surgery sometimes. And then someone who can kind of look at, okay, how can we create our healthiest behaviors? And the reality is, like, all of us need to be working towards our healthiest behaviors, no matter what your body size, no matter if you have obesity or not. That's the goal for all of us. And it doesn't happen by default in our current environment, especially what Corey was talking about earlier. Like, we live in an obesogenic environment full of hyperpalatable foods, where we're sedentary and we're isolated and we're stressed out. Everything is conducive to not our best health. And so we have to be really intentional about that. And then others of us have learned that food is a really good coping tool, right? To get through hard times, or to not even just to get rid of negative emotion, but to create positive emotion, right? Some of us, food is like the most fun thing that we've got going on in our lives. And so we have to look at that too. And so we kind of have to tackle each one. And rather than that being really overwhelming, because I know it's like, well, where do I even start? I think the starting place is just choose one of those things, right? Just choose one of those things to start looking at and get the support that you need, whether that's from a therapist or from your physician or from a nurse practitioner. Like there's, there are many more resources. And I think that's the exciting thing about this field. Since I've been practicing, like we used to have no tip, like we had nothing to offer people when I was first starting. Like we would just give them a list of 200 calorie snacks, and like that was the extent of it. We would give them like a calorie snatch, and like that was all we did, because that was all we had, right? And so the hope message is now we have a lot more. We have a lot more tools. We have a lot more medical treatments that we can offer people, and physicians are. It's a slow turning of the tides, but it's getting there, right? So reaching out to your physician and then asking for a referral to an obesity specialist if that's needed, I think is a good place to start.